Good evening and welcome to Tulane Parents. My name is Penny Wyatt and I'm the Director of Parent Programs at Tulane. One of the ways we connect with parents is through webinars on issues that students face as they navigate through their college experience and the resources Tulane offers to support that journey. Thank you for joining tonight's important webinar, College Mental Health in the Age of COVID-19. It's my privilege tonight to introduce the panel members. First, Nancy Roy, who is the Chief Clinical Officer of the Ed.D Foundation, a nonprofit which partners with high schools and colleges to strengthen their mental health, substance misuse, and suicide prevention programs and systems. Tulane has partnered with the Ed.D Foundation since 2015. Next, Scott Timms, Assistant Vice President for Campus Health here at Tulane. Also, we'll have Elisabeth Turner, who is a Newcomb College alumna, parent of a current Tulane sophomore, and member of the Tulane Parents Council. And last, we have John MacPhee, who's uniquely qualified to moderate tonight's discussion because he's the Executive Director and CEO of the Ed.D Foundation and parent of a 2019 Tulane graduate. His expertise on this topic and familiarity with the Tulane community and culture will be of great benefit to us as he guides the discussion tonight. Many thanks to all four of our panelists for their commitment to assisting Tulane parents. Now I'll turn things over to John to begin our presentation.
Thanks so much, Penny, and thanks everybody for joining us. It's my pleasure to have this opportunity to moderate this event for you tonight. And as Penny said, I'm the proud parent of a Tulane graduate. So tonight, we're gathering to talk about college mental health and how to support the mental health of students during this time, during this, pandemic. And in terms of how we have this event organized, Nancy and Scott are going to have a discussion about both the national level trends and what's happening specifically at Tulane related to student mental health. And then they're going to be joined by Elisabeth, and we're going to have a Q&A where we answer your questions. So before I turn it over to Nancy and to Scott, I just want to remind you again to please use the chat to ask any questions that you have, okay? And with that, I turn it over to Nancy and Scott to frame this for us.
Thanks, John. So I'm going to get started with some of the national trends, some of which I think will probably be playing out quite consistently on the Tulane campus, which we'll hear from Scott when I finish with the trends. And so I have two sets of data that I wanted to talk about. The first is sort of the national trends that we've been seeing sort of pre-COVID. And we know that some things certainly have changed around mental health and the struggles that and challenges that students are facing with the onset of the pandemic. But let's first set the stage with what we know over the past 12 months that students are reporting in terms of mental health. And the data I'm going to be sharing with you comes from the American College Health Association. They do a national college health assessment each year. And so this data is coming from their spring 2020 report alongside the American University and College Counseling Center Directors fall 2020 report. And so they're saying that in the past 12 months, they asked students, in the past 12 months, they asked them about anxiety, depression, and a number of other issues. 2 out of 3 students reported on these surveys that they felt overwhelming anxiety. 1 out of 2 felt too depressed to function. And by that, they mean, getting to class, getting out of bed, socializing, going for meals, things of that nature. 1 out of 3 are binge drinking regularly. 1 out of 8 are abusing prescription drugs. I pause on this one because, we work with schools across the country. And while most of them will tell us that marijuana and alcohol are the 2 most misused substances on campus, which is true, we know that prescription drug abuse is on the rise, as we, of course, know the epidemic in our country with opioid abuse. And so we really are trying to hone in on really educating students about the dangers of prescription drug abuse, especially in combination with alcohol. And so that is something we're really encouraging our campuses to be on the lookout for and sort of get ahead of if they can. 2 out of 5 are struggling with food insecurity. This is sort of new in the data. We have, most of the assessments have not been tracking that on an annual basis, but this is something that, of course, I'm sure all of you have heard about. And some with surprise. Many think, college students do not struggle with food insecurity, but that is not the case. 1 out of 3 have said that they've witnessed race-based discrimination. Again, in the recent months, that's something that we can clearly understand given what we've all been witnessing. And they're saying that they're seeing this both online as well as live and in person. 1 out of 3 report having serious thoughts of suicide. So not just passing, suicidal ideation, but serious thoughts of suicide. 1 out of 10 are engaging in self-injury. So by that we mean cutting, burning, engaging in dangerous behaviors. 1,400 in the past 12 months died by suicide. And yet most counseling centers, and Scott can speak to Tulane specifically, most see an average of 12 to maybe 15% of their students on campus. And many of the students that are at most risk don't present for service at their counseling center. And in fact, of the campus suicides that we read about, of the 20% of the campus suicides that we know, 80% had no contact with their counseling center. So when you read about stories, in the Times or wherever where there's been a death by suicide on a college campus, more often than not, that student is unknown to their college counseling center. So I'm going to shift really quickly, and I'm really eager to hear Scott's thoughts about the national trends relative to Tulane's campus, but I want to spend just a minute more talking about what we know so far and the impact of COVID on mental health. And I'll say that this data is coming also from the American College Health Association in conjunction with the Healthy Minds Study, which is a group out of the University of Michigan that surveys students' attitudes, awareness, and behaviors around mental health, as well as the Active Minds group, which is a student advocacy group advocating for mental health on campuses. And what I hope we'll be able to hear maybe more from Scott, this data that I'm going to present is really coming from the spring and the fall, early in the fall, but not so much since students have been back on campus. So it's not really going to speak to what they're experiencing right now, if they've come back on campus or if they're remote. But what we know so far from this data is 2/3 of them are reporting financial stress as a result of the pandemic. Either they themselves have lost a job or their families have lost jobs. Especially if they were doing a work-study program and they had to move to remote, they lost those jobs. So that's a big stressor. 60% were really anxious, feeling susceptible that they would get the virus, but even more so, worried that a family member or a friend, a close friend, would contract the virus, especially grandparents, parents, people like that. 60% of them, and this is key, I think, are reporting that the pandemic has made it difficult to access mental health care. And that, I think, is, and I'm eager to hear from Scott, still something that many campuses are struggling with. I'm not sure how it's playing out on Tulane, but we do know with many of the campuses we work with that moving to remote teletherapy for those campuses that are still remote, for example, there's many challenges in being able to continue with on-campus providers if they're not licensed in the state where the student is now residing. And so then trying to refer students just to the community, you have to know if they have insurance, are there providers in their community? So access to care has really become problematic for many. 91%, not surprisingly, are reporting increase in stress and anxiety. I do like to just make mention that We're not necessarily talking about clinical diagnoses of anxiety or depression necessarily on the rise, but we are talking about symptoms of anxiety. And there is a distinction between a clinical diagnosis and feeling anxious or feeling more depressed. But certainly a huge increase in stress and anxiety. And probably most of us can relate to that as well. 81% have reported an increase in disappointment and sadness. And we know this from what we've read in the news and what we've seen and what we've heard from our students, right? Disappointment in missing traditions on their campus, whether it was a graduation or for younger students, a prom, being able even now to gather with their friends in their usual ways, which is all but unusual right now. 80% are reporting an increase in loneliness. Again, thinking about, especially if you're remote, trying to connect from home, or you're not with your friends and your cohort groups, even on campus. The ability to gather with friends is certainly far more restricted and limited. So loneliness, 80% reporting loneliness. And 76% reporting difficulty in maintaining a routine, especially if they're in a remote environment. Very difficult to juggle being at home, trying to access the internet, quiet spaces, managing just staying on track with academics and everything else that's going on in the place where they're living. So a lot of additional challenges with COVID, which is no surprise for any of us. But I'll be curious to hear from Scott how any of these in particular are playing out more or less on the Tulane campus. So I'll turn it over to you, Scott, for that.
Thank you, Nancy. It's an interesting time for us here, and I would say that mental health has been something that we've been trying to address or to improve how we address it for many, many years. And that's how I know Nancy. We've actually been able to work together on our projects here and done a lot of quality improvement in trying to improve access to counseling services. So in 2013, we actually sort of had a reboot and started over with counseling, and that's when CAPS came into play, and we actually just changed the names with the Counseling Center. So I use those two terms interchangeably right now. But if you go back about 10 years ago and look, we used to offer students about a semester's worth of therapy their entire time at Tulane. We now offer students 12 sessions per academic year, which was a significant increase. We also have about almost 2, maybe 3 times as many therapists as we had back then. Our access model has changed. It's much more structured. We have a care coordinator that links students to the community for providers and things like that. So our system for the counseling center is drastically different, and we've every year tried to make big improvements on that. We have a diverse counseling staff with a variety of different identities to help serve our very changing student population, and have really tried to do what we can to improve in that access, change the access model for that reason. I would say Tulane has some very specific challenges that we've also been addressing, and I'll highlight 2 of those. And I think everything Nancy said that we see nationally, we see here. I would say that there are certain things we see in worse ways. I would say stress, anxiety, and depression. Our students report that at a much higher level than what we see from our peers or peer institutions. And I would say one of the other large drivers that we grapple with here is alcohol. The alcohol use among our students is significantly higher than what you would see at most other universities. And so we've done a lot of work to reduce alcohol use. We now have a recovery community on campus to support students in recovery. We also have a substance abuse evaluation office to help students make decisions about what they should do. The other, I think, large driver around the mental health issues that we're dealing with is sexual assault. We know that alcohol is used to facilitate sexual violence, and we see a variety of students being impacted by that trauma, and we need to be able to support them and help them engage in treatment. And so if you look at the amount of mental health issues that are impacting all college students, and you couple on the factors that we have where most of our students are far from home, we know that New Orleans, it gives them very easy access to alcohol, and we know that the amount of violence that they're experiencing is also high. There are just a variety of factors that make being at Tulane challenging for many of our students, and so our support services need to be able to address that. And it's hard. it changes constantly. The needs are varied. And so we really have to be nimble and adaptive. And we really rely on a lot of feedback and support from our partners at JED, as well as from our parents who have been able to support that. This fall has been exceptionally challenging with COVID. And I spend most of my days now talking about COVID and testing. But there are a couple of, I think, big pieces that I would highlight. We have often struggled with a social disconnection among our students with, I would say, Facebook, because I'm old, but they're doing all other types of social media platforms that are, even in non-COVID times, I think challenging and sometimes limiting their ability to engage in person with us. I think COVID has, in some ways cut off some of those natural connections to other people on campus. And so we're seeing a lot of students who report being lonely. They're more isolated. We have a lot more students who chose to live in singles or alone. And I think that is not as good as it sounded in the beginning. It might keep them a little safer from COVID, but I think they're missing those connections. A lot of our big events, a lot of our opportunities for students to get to meet haven't happened. We've actually been talking about, would students want to go to a football game? And that's not something a lot of our students often do, but we really wonder, would they want to go so they have that opportunity to socialize in a different way? But with our COVID restrictions, those things haven't happened. So I think there's a huge disconnect there, and even getting them to the clubs and organizations or things like that just aren't happening as we see typical. I would also say that we've seen that the stress and anxiety about fear of getting COVID being a significant impactor on our students. We've actually had students who have called because they thought they had COVID and believe they needed to go to the hospital, get there, and what we find is they're really dealing with anxiety. It's more of an anxiety attack, a panic attack sort of playing out physically there. And an interesting data point that I would share for us this fall is that typically at this point in the year, CAPS has got a several week wait. Now, we changed our model this year so that we can accommodate same day appointments, and that actually has worked well. But I would say that CAPS is not as busy this year as it typically is, and that's a trend you're seeing play out. What has happened, though, is that I think students are so hyper-focused on COVID-like symptoms and whether they're physically ill, they're going to the health center in greater numbers. We actually have a behavioral health therapist embedded at our health center who is seeing a significant number of students every day, a much higher volume than we had seen in the past out of that position, because students are coming to the health center when they maybe really need to go to CAPS or to the counseling center. So that's sort of an interesting shift for us, that I think COVID has become the focus, and they're seeing this physical manifestation of stress and anxiety and not really identifying it as a talk therapy situation. We have the capacity, they just are not thinking that route. And I think COVID has sort of created a sort of a blinder for them in regards to how they need to get help. I would also say, one of the innovations that COVID brought to us is telehealth. And that has drastically changed how students are accessing services. The majority of our counseling center visits right now are via telehealth. I think that there is some struggle because not everyone likes that. And so we have to figure out, how do we find a balance of a student who really wants to be seen in person versus telehealth? How do we link them up? I think it's also removed some barriers to students who are afraid to walk into the counseling center for the first time. They can make an appointment online, and then they can have a telehealth visit and sort of see what it's going to be like, and it's not there. I think at Tulane, there's another important part of our community of care that I want to highlight that I think is different than many other universities is student resources and support services, and specifically our case management and victim support services. So in case management is a non-clinical service, so they work very different than the counseling center or the health center, and that they're there to really provide ongoing support. They will text with students, they call and check in. If we have students in quarantine and isolation, they're all assigned a case manager who will reach out and help them navigate. Have they notified their professors and their faculty about not being able to be in class? Do they have everything they need? Are they doing okay? Do they need a therapist? Do they need those sort of links? So those case managers here really provide a very supportive role. And I sometimes think of them as a surrogate parent, and that they're local, they're sort of there, they do more frequent check-ins. They're a little bit different though, in that they're not a family member, so they can be a little more honest, and that they can help them work the Tulane system to get into the appropriate service. So I think that's a really important part of our community of care here, because they can do things that our counselors don't do. And and they can provide input to the counselors when someone needs something that might be different. So it's a really important part of that. Yeah, I think those are the highlights for me. Nancy, is there anything specific that you think might be helpful to comment on?
Well, 2 points that you raised, Scott. The first being the large numbers of students that are going to the health center. And I just want to applaud Tulane for having a behavioral health embedded in the health center, because we know with all of the colleges that we work with, far more students go to the health center that will ever go to the counseling center. And so if we're not catching them at the health center, we're missing a whole lot of students who would otherwise fall through the cracks. Because most students, feel much more comfortable going to their doctor than going to a therapist. So the fact that you have someone in your health center that's catching these students and providing services is great. And so yes, I'm sure many of them are coming to the health center because they're afraid they have COVID, when in fact, as you mentioned, they're anxious, they're scared, they're stressed. And so they're actually able to access the support care they need.
Yes.
In the environment that they feel most comfortable with, which is excellent. And then the other piece is the case management. I can't say enough about, I wish every campus had care managers or case managers, because those folks not only provide ongoing support, but they can provide referrals and check in with students, make sure they're getting what they need therapeutically and otherwise. I mean, it's interesting that you say, especially the students that are in quarantine, they're getting check-ins, because we've seen on social media or in the news, the stories of the students who are, holed up in a hotel and they didn't get food for 5 days, right? And so we want to make sure that we have a system in place where that's not happening for the students. So both of those things, I think, are excellent resources. And I wish all schools had them, but they're central, especially right now. So that's great.
I think quarantine and isolation would be the other, I think, probably one of the biggest challenges that we've had this fall. And I would say that, we went into this with a plan around testing and quarantine and isolation. I think quarantine and isolation was very different when we actually started having to do it and we had students in those spaces. I think the needs were different. I think the fear and anxiety and the management of it was different. And it was different in those first few weeks when we were seeing our surge in cases than it is now, where people are a lot calmer about what it means if you get COVID. So I would say that if you've had a student that was in quarantine or isolation, and I'll be honest, like if I think about it, if my doctor told me I had to go to quarantine or isolation, it doesn't sound like it does sound fun because I've been working 7 days a week for a while related to COVID. But I mean, in general, I don't think any of us would want to go into quarantine and isolation. It's cutting us off from so many of our normal things. And I think for students, that's been especially challenging. They were trying to do coursework remote. They were not necessarily with their friends. They were also quite afraid about what might happen to them if they got COVID, because there's been so much in the media of that. So I think that those students have had an especially trying semester, and we've had students who've had to go to quarantine more than once. They've been lucky. They never tested positive, but they've now spent 28 days in quarantine, and they don't want to get it again. So there's some fear and some pieces there. I would just add one more comment, and I've probably talked too long, but I do think that there is, at this point in the semester, one of the things that we're seeing is a lot of fatigue from students with all of the things that we've been asking them to do. Wear a mask, go get tested, stay 6 feet apart, do this, make sure that you're here and you're there. And I think that it's a very different semester. I know that all of us that have been working on campus are feeling the strain of trying to maintain all these new sets of rules. For a first-year student who just got to campus and is trying to navigate what it means to be at Tulane and to be far from their parents, it's even more challenging. And then if you've had time in quarantine. So I would say that this fall is not typical for those students. And I think we've talked a lot about like, what is their experience and how do we help them get more connected? And it's hard. I don't think we have great answers for it because it's so challenging in that we would typically organize dinners or have clubs and groups outreach. We can't do those sorts of things. So, and I'll tell you, Zoom does not make us feel as connected as an in-person meeting. Even though I think our students are much better on computers than many of us might be, I think that they're struggling with the idea that they can't have those personal connections right now.
Yeah. So Scott and Nancy, thank you for that discussion. we're going to continue it in the format of responding to many questions we've received from the audience. And I'm going to ask Elisabeth to join us, and Elisabeth has joined us. So terrific. So the first question I want to ask is Scott, picking up on your comments, this question is for everybody, but picking up on Scott's comments that a lot of students are experiencing anxiety and fear about getting COVID. We have questions related to students who did get COVID. And the comments are that, you know, the students who got COVID are experiencing shame, actually. They feel ashamed, you know, for having gotten it. And so the question is, you know, what can be done to sort of help them with their emotions, feeling this sort of shame and, I guess, sense of responsibility or guilt, actually, for having gotten COVID?
You know, that's an interesting, I haven't heard that comment back. What I do know is that our students, there's a segment of our students who have been very concerned about the New Orleans community, and that coming back and having COVID might mean that we impact the community. And we've been very clear about expectations because we didn't want to be one of the reasons that the city couldn't reopen. So I could see where that could become a challenge and there could be some fear with it. At this point, you know, we have many hundreds of students that have had COVID. One is that I would not hope that we would make anyone feel that way, and what we can do to alleviate it. I think that's something that I could take back and just sort of consider in our conversations as we do our communications as we go forward. I do think if they're really struggling and they're afraid of being found out, I think that's definitely a good opportunity to work with one of our case managers or with the counseling center staff. I think they can really help sort of process what that means and how to navigate that communication. I would say that I haven't heard that a lot, but it's good to know that that's bubbling up, and that might be something that we could address in one of our future conversations.
Well, I can speak to that. So from what I'm hearing from my son, from traffic on the Facebook page for parents, the kids are getting really mad at kids who aren't being careful.
Yeah.
They don't want to go into quarantine. They don't want to go into isolation. They don't want to go into contact quarantine. And they have, they've already experienced, for the most part, a lot of them have already experienced it once. And it's often based on somebody doing something horrendously stupid. And I don't mean that to shame the person who was doing it. And we've all done things, we all have our own rules, but it's definitely, the kids are getting super mad. They're getting angry at other kids who are making them pack their things and go into COVID. So I don't know how to reduce that anger and teach these kids to have a little, we have a word in Yiddish, rachmanis, a little more patience, that this is, you know, that no one's been to this rodeo before. But perhaps there should be a way of teaching the kids to be a little bit kinder, because it's going to be them too.
I'm thinking, you know, not every student who gets COVID has been reckless, right? And so,
right.
You know, it's hard if there's a generalized feeling among the student body that if I come down with COVID, it means I was irresponsible. And so perhaps, you know, as you think about messaging, Scott, you know, there can be some messaging around normalizing, look, anybody can get it. Now, yes, you can get it if you're reckless, and we hope that's not what you're doing, but let's also not condemn every single person who contracts COVID, because we weren't all out at the club, you know, kissing tongue.
Yeah, I think what happened was, in the beginning, it was really, the kids were not getting the message right. That first week between testing and moving in, a lot of kids, you know, having been cooped up, were just so naturally happy to be with one another, and they really, you know, horrendously stupid was what my son was, what he said. It all was perfectly normal to me. I think the kids are being a lot more careful now, but I think that anger is still there. I think that anger is really, kids are still really angry.
Yeah.
I think there has been a phenomenon right now that I think is unique to us at Tulane, in that I think a lot of students have taken the responsibility of reporting when they feel like someone has violated the rules. We have a COVID reporting form, and you can report, like, I saw someone not wearing a mask, or I think whatever it might be. And we've seen a tremendous amount of students policing themselves this year. And some of that's helpful because it allows us to know when we might need to intervene or things that we need to do. I think there's also some students who have gone to a little bit of an extreme there and sort of are reporting every infraction when your mask might be a little bit out of place. And so I think there is some balance to it. I think a lot of students wanted to be here and they felt like they needed to be very vigilant in order for us to be open, and because they wanted to be back on campus. But I think there is a balance there that we can definitely try to address as we go forward. So.
Yeah. I'm going to pivot to another sort of set of questions, which are along these lines. So if a parent is concerned that their student is struggling and might benefit from a visit to the counseling center, but that student isn't motivated to do so or doesn't necessarily think they need to, right? What should the parent do? What can they do?
So the easiest thing to do is, one is I'm not a fan of trying to make someone go to the counseling center. I think that they need to sort of want to do that. But I think the best way to nudge them is through the case management program. So if you go to tulane.edu/concerns, you can file a report. You can actually file it anonymously and just sort of and that will trigger a case manager to reach out to the student, have a conversation. And sometimes it's that simple conversation with a case manager about what they need. They can check in with them, do a follow-up if necessary, but they can also link them to the counseling center. We've had case managers walk a student to the counseling center because that's what they needed. But I think that to me is the best first place if you think you can't make that sort of a conversation or make that happen with your student. The case managers are great. They'll keep them on their radar. They can work with them a few times and sort of help them over whatever's there. I'm always just cautious, like, people need to go to counseling when they're ready. Sometimes they just need to have a conversation with someone in a case management function. And a lot of times that can help accomplish that. I'd be curious from Ms. Turner, as a parent, how you might answer that as well.
So I'm a little different. My son came into Tulane with we knew he had an anxiety disorder and depression. So we actually came into Tulane immediately going to CAPS and, getting him set up, and then got, what's it called when you go to outside, because he was going to need more than just 12 sessions, right? He was going to need to see a therapist once a week like he was doing for continuity of care. But having said that, he had a very good friend last year who needed therapy, not therapy, but really he was worried about it. He called his parent. The parent tried with the student to get him to consider counseling. And it was actually Jackson and his peers that were able to convince this young man that he may need the benefit of helping. The benefit of some help. And I think the fact that Jackson had been in therapy for quite some time sort of took the stigma away from it. And that's actually that's why I care so much about this topic and why I'm on this panel, because the stigma is there, much like, that COVID stigma. We need to get rid of stigma. So my suggestion is, if that child has a friend, it might be, it's tricky because you don't want to betray the student's confidentiality, but if there's some way or maybe just encourage that student to speak to their roommate or to a friend, and maybe then something may be able to come about in terms of counseling.
We know that the data shows us that students or young people turn to their friends more than anybody else first for support when they're struggling. So I think, following on what you're saying, Elisabeth, that yes, if they have a close friend that they feel like they can confide in. And I would also say, because unfortunately going to therapy can feel intimidating or I mean, the good news is I think stigma is on the decline among young people, but it's not to say it's eradicated. That is there a trusted adult in their world on campus? I mean, that can offer a warm hand or support. I mean, one of the guiding principles of our work at JED, and Scott can speak to this, is you want to create a campus of compassion, where there's no wrong door to walk through for support. And, not everybody needs direct clinical service, but they certainly could benefit from a warm hand from a faculty member, from a dean, from an RA, from security, from a coach. So there's many people perhaps that this young person might turn to. And then, of course, if they clearly need direct service, they have a partner who can help get them connected so that they have somebody that's in their corner.
Yeah. And Nancy, you mentioned RAs. Oh, Scott, I think I'm going to pass this question to you and you can add to it, because Nancy just mentioned RAs and there's a question about RAs. What, sort of what role do they play in a healthy dorm life and a healthy campus life, and what should parents know about that RA role?
Sure. I think RAs, that is probably one of the most difficult jobs on campus, because everybody believes the RAs should be able to do all these sort of multitude of things. But from my perspective, a good RA is someone who sort of knows their residents, provides some opportunities for community building, helps bring them out of those rooms and gives them opportunities to meet each other, to talk, and can be that supportive person in times of trouble. They notice that the resident's struggling, having a conversation with them, checking on them, and maybe helping them get to counseling. I get a lot of calls from RAs because they're like, Dr. Timms, what do I do? I see X, Y, and Z. And so I think a lot of times they're sort of frontline. They provide us a lot of feedback about what's going on. They can also make or break a community for first-year students and help them get to know each other and sort of facilitate that. This year, it's hard to be an RA in times of COVID when we're limited on size. I think there's a lot of fear about mixing pods and sort of that sort of perspective. So RAs are great resources. I think they're also undervalued sometimes. And so I'm always an advocate for more resources for our RAs so that they can do more with students, and it's specifically challenging. There is a program that we have right now that I also think is really valuable, and it was put in place partly to address, I think, what Nancy's talking about, a kind person, someone who cares. And we have a peer counseling program that this is our second year with, and it's an exciting program in that we have a cadre of we have a lot of students who work in campus health and helping professions and different pieces. And so it was a great opportunity for them to learn some additional skills. And then what we had done last year is outposted them in residence halls where we knew that there was a retention issue and a lot of the students were not getting connected as well. And so we placed them there. They did community events, so they would do crafts, but you could stop by and talk. And it was sort of someone who was there. They could help facilitate conversations. They could talk to you one-on-one if you were struggling. They could help you get linked up to counseling or someone like that. And so it's a really great program. With COVID this year, it has not worked as well. And so we've actually been able to redirect those students to work with our students in isolation and quarantine who are struggling and more disconnected. So I'm really excited about that. And again, I think that everything that we've done at Tulane, I think, really aligns with what JED has been doing in regards, we want a community of care. We don't want there to be a wrong door, and we really try to make sure we're coordinating across services so that it supports. And so those peer counselors had to know all about case management and all about counseling in the health center so that if we get them there, they know how to link them to the appropriate office.
Great. Thank you. Scott, there's a couple of specific questions that I think you probably can answer pretty quickly, but I want to put to you. So one is, if somebody uses this case management system, how quickly does this sort of system react, and will a sort of student be contacted?
Typically, once we receive so there's a couple of ways. It could be very quickly. So if you filed a report and said someone we thought was going to hurt themselves, there's someone on call. They monitor that. We have on call. We have a student affairs professional on call 24 hours a day. If the student's just struggling and you want somebody to do an outreach, within 24 hours, I think in all cases would someone reach out.
Okay. And then the other question is, if a student does agree that they should go to the counseling center, and this is probably a very simple answer, but to just make sure everybody understands, what do they do next?
They can walk in. So we actually changed the model this year. Again, we used to have a long wait. We no longer make future appointments. We make appointments today. So it's a same day access model. It's new. It's not perfect, but what it has meant is that we have appointments open every day at the counseling center for first-time visits. So that means that on any given day, a student, they can go that morning and they're going to get seen that day. We've been tweaking the system. It's worked pretty well, but it has really changed the accessibility of a student to get to a counselor on that same day that they need to be seen. There's always emergency and crisis walk-in available as well.
Great, great. Now, could we talk a little bit more about students that are in quarantine? So for those students in quarantine, what can be done to support them and their mental health while they're being isolated? What can families do? What is the school doing?
Yep. So every student that goes into quarantine or isolation, and the systems mirror, so just assume I'm talking about both. And again, I think that the system has changed over time because we realized very quickly that there was more support needed. Once they go or identified, a contact tracer usually will call and give them the information, and they have some choices. We don't force students into our space. A lot of students live off campus, and so they prefer to stay in their space because they're typically quarantined or isolated or in isolation together. But once we know where they are, we file what we call a report, a MacPhee report, and then that links them to a case manager. The case manager will reach out to them usually within 12 to 24 hours. It's usually pretty quickly, depending on when we found out about the case, and make sure that they're connected. They know how to manage the academics, that they have everything that they need, that they can be self-sufficient there, and checks in. Some students like a lot of case management, and so that case manager will work with them throughout that time. Sometimes it's like, I'm pretty good, leave me alone, and those students are more independent. So they can really get as much or as little support from us as they need. Again, once they're in quarantine or isolation, if it's really difficult for them, they can do telehealth visits with the health center for any kind of physical health, or they could start therapy with the counseling center. So all of those resources are available. We've also, in the last several weeks, again, I think there's this recognition that they need something that's not really treatment. It's not really therapy. It is engagement with the community. And so there has been an emphasis to make sure those students are aware of a lot of the regular student programming is virtual. So there are trivia nights, and there are events like that are happening. And so there's been an emphasis to make sure that those students know about those things, because they can log in and do Zoom trivia night with all the other students on campus. So we've been making sure that that's happened. We also shifted those peer counselors to be available. And so they have created craft kits for students in isolation, and have hosted some crafting nights with them, so they can all get together and have those opportunities to engage. So we have added a lot of support from the beginning to now based on what we saw was a real identified need. I think from a family perspective, the number one question I got when we first started moving students into Patterson is, can I send them a care package? Can I have something delivered? Yes, please. We're happy to drop packages off. The students in the Hyatt apparently set a record there for food delivery. So, they get 3 meals, room service a day. They, had DoorDash and Uber Eats and all those things delivering so much, the Hyatt actually had to have somebody extra on staff to do those deliveries. So, I think care packages from home are a great way to do it. I think special food deliveries, flowers, I think anything that might just sort of brighten their day, it's fine. We get packages from the mailroom for them. So I think those sorts of things that you might do for anyone who's having a bad time would be really appreciated by parents.
Great. Yeah. And Elisabeth, yeah.
Another thing that is good is to send, believe it or not, jigsaw puzzles, especially for the students that are by themselves. Another parent I know sent a walkie-talkie set so that he could talk to his roommate who was right next door. And I don't know, for some reason that was fun for them, even though they had cell phones. Be creative. It doesn't have to necessarily, food, yes. Food, absolutely. But also things that are going to keep them busy on their own, I think is hugely helpful.
Great. So there's also questions about, what about the students who are so afraid of COVID that they're not socializing at all? And a related question, I'm going to merge these two questions together. There's a question about, what is Tulane doing, or can more be done about doing engaging things outside safely, but like outside, taking advantage of the outdoor space, to have sort of socially distanced discussions or games, that kind of thing.
Well, I can answer that. Hillel has just started outside yoga. And have gotten quite a few, and you do not have to be Jewish to participate in anything that Hillel does, nor do you have to be Jewish to send your child who might not be well Hillel matzo ball soup. So, and that's, so I heard that they've just started yoga outside, and it's gotten quite a few students who have been involved. And it's, again, safely distanced. It's, adults are in charge.
I think we've talked a lot about how do we encourage some outside events, on campus, what can be done. I think it's also important to recognize that New Orleans has some pretty significant limits on what can be done outside right now. We just changed phases, and we're talking about what does that mean and how might that we change rules here. But I would also say we're very hesitant to do anything that's going to put us at risk for COVID surge or spread at this point. We've monitored the data very carefully. And so all of our programming and decisions around that have been based on what we think is safe. And we're hesitant because we don't want to see a surge. I do think we're having a lot of discussions about that. I know that one of the pieces that I think a lot of people have missed out on this year were club sports and intramurals. Some of those are happening, but they look different. The Riley Center, I think, in campus recreation is still a really great resource for students looking to meet others and have outdoor activities. Those programs are all going on. It's different and it's more restricted in regards to size limitations and pieces, but they've got great health protocols to sort of provide a safe space for those sorts of events. So there are some opportunities like that. I think we're constantly looking how we can promote them, but I think sometimes it's helping students, especially newer students, find those on campus because it's harder this year.
Would it be helpful to reassure students who are nervous to say there have been no known documented cases as a result of using the Riley Center? I just read that Tulane has the #3 tracing program in the country. And, so we've used our phenomenal award-winning tracing program, and the Riley Center is safe, and this is safe, and trust us that, maybe that would be helpful to bring these kids who are really scared to come out and maybe get engaged.
It's a good idea. I think it could also be something that we message more about so that they know they're available. Yeah.
Well, it's an interesting point because most of the messaging is around, can in fact evoke fear, right? You got to be safe, you got to wear your mask, you got to stay apart, blah, 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 and not a whole lot of messaging on the other side where these are some things you can do and be safe. It doesn't have to be an all or none. And so maybe, like positive psychology, focusing more on the positive side and what is possible, because all of us, our whole world, not just Tulane, but our whole world is focused on don't do this, don't do this, don't do this. So how can we have a more strengths-based approach that sends some positive messages to help distill some of the fear?
And maybe what I would suggest, and I think a lot of times students don't read what we send out very much. I think it's oftentimes the parents. And so maybe I could ask is I could work with Penny and we could include some of that in her next newsletter so that parents get it, and then parents, I think, telling the child or their student about it, I think might be a better strategy. We struggle sometimes getting students, of course, to read the long emails that we send out, but I think just get that information into the parents' hands, that would be really useful.
Well, also, I'm sure you know this, Scott, and I'm sure you guys do this, but having your students do the design and delivery of the messaging, because I always say, I can think I've crafted the best message and all they hear is wah, 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 right? So they listen to each other. So if they know the witty ways to say things and where to put them on social media. So having your students do the messaging goes a long way.
Yes.
Yeah, I think somebody mentioned in the chat having COVID ambassadors, maybe to that could do that. And I think that's a great idea.
Yes. Scott, Is there a limit on the number of visits to the counseling center? And then what happens if a student, requires, more ongoing care than that limit?
So our rule is 12 visits per academic year. And if you look at that, that means you could go about weekly for a semester or every other week if you were going the whole year. So when a student goes to the counseling center, there's an assessment done and really determined. So the counseling center is designed to be short-term. It is not a long-term therapy model. And so if someone really has a chronic issue or is someone that's going to need really long-term treatment, we have a care coordinator that will work with them and help them find a specialist in the community based on what their needs are that can take them and so that they can have uninterrupted treatment there. Now, we will continue to see them at the counseling center until we get them linked there to make sure that they're fine. And when I say that there's a 12-limit session, if they needed 13, that would be okay. If they needed 10, that would be okay. But, we really, in order to make sure we have availability for everyone, we do have we are short-term model, which is what you see on most college campuses.
Yeah.
And that is, I can second that. And there's very few, I can't even really think of any anymore that have an unlimited psychotherapy model. But I think your point about having good referral base, knowing who your community partners are, making sure not only that you don't just hand a student 3 names and say good luck,
Yes.
but you really walk them through it, coordinate the referral, make sure they get there, and that's where your care management system comes into play. Again, it's probably one of the best cost-effective ways to support student mental health is through a care management program, especially when you're trying to refer off campus. Knowing who your players are in the community. Do they know college health? Do they know the issues for this age group? Are they connected to your university? Are there clear communication patterns? All of that stuff they can coordinate, and that's essential to have this work.
I would say that's
It
one of
worked very well for us. It really did. I am a testament to it being referred, finding somebody phenomenal who, is a 5-minute drive from Tulane's campus and has basically her whole practice, his former Tulane students and Tulane students.
I think
sorry, go ahead, Scott. Go ahead.
Sorry, probably one of the best things we did is have that curated list of who we know would be good for students that are close by, that are easily accessible, that also will work with us. So if they have a Tulane student and they know they're struggling and are worried about them coming back and being alone, them knowing to call so that we can activate those other services. So I think that referral list has built up over the years, and we're really specific and picky about who we let be on that list.
There's one final question. I'd like to ask all 3 of you to answer it before we wrap up. And that is, what advice do you have for families about how they can help their students keep a positive outlook?
I'll say that I think one of the best things parents can do is listen. I think sometimes, and I'm a parent as well, we tend to jump in with advice, with direction, giving your student a space just to talk and actively listen to what they have to say, validate their feelings, support them in whatever it is that they need, but let them take the reins and be in the driver's seat and follow their lead would be my suggestion.
I would say twofold. Number one, even if you're panicking, do not show your panic. You must show calmness and faith so that the student feels a sense of calm, at least coming from you. You may be losing your mind and you have all the resources to contact once you get off the phone with your student, but try not to panic. And the second thing I would say is, like Nancy said, this is an opportunity for our students to learn not only chemistry and psychology and math and art, but also the art of self-care. And you can help guide them by telling them what is available to them and encouraging them to use it and letting them, like Nancy said, go with it from there. And there's nothing wrong with then checking in and saying, did you ever call so-and-so? I think, but trying to come in and take over, number one, is always a mess because you're calling this person and that person, it doesn't work ever. But also it infantilizes your student, and it actually contributes to their anxiety, believe it or not. So that would be my suggestion. That was mistakes that I made freshman year, to be perfectly honest. So I don't want you to make those mistakes.
Scott?
Yeah, and I would agree with what both said. And I would also say that sometimes if you're not sure what to do, you know, all of us that are working on campus are happy to talk to parents. And I get a lot of these calls. I'm so upset and I don't know what to do. And that 10-minute conversation for me to give you the talking points so you can go back and have that conversation with your student, I'm happy to do that. Send me an email. COVID, it's been a little harder to reach me, but you know, I think our Dean of Students, Erica Woodley, is fantastic and phenomenal about working with parents. But any of us that are here are always happy to talk with parents to help you help your student. And I think a lot of, to what Ms. Turner said, is we really want the student to come to us, and it's better. So if we can help coach you on how to do that or who to get them to so they get what they need, we're happy to do that. And so I just want to make sure everyone knows we're accessible, we're available, and we want to see your students succeed as much as you do.
Terrific. Well, that's our Q&A. I want to thank the panelists for a terrific discussion and thank the participants for the lively chat and all the great questions that you asked. I also want to thank Tulane for its commitment to student health and student mental health. I think you're doing a great job supporting students, and it's very difficult to do, especially during this time. Nancy and I and our colleagues at JED, we see a lot of schools and a lot of students, and we really commend what's happening at Tulane. I'll also say, as a Tulane parent, and my daughter graduated in 2019, it's also terrific to see the Tulane alumni community and how she's benefiting from that and those connections even now, even after she's graduated, as part of the community that's helping her through this time as a young adult. We're going to preserve the chat, it's my understanding, so that I think is going to be available. And I am going to just ask our hosts, are we done, or is anybody going to wrap after me? Okay. I think we are done. And so thank you, everyone, for a great discussion.
Bye.
Bye. Bye.